Hello and good morning, everyone. Welcome to the Healthy Cities, Healthy People Conference. A warm welcome to everyone joining us here in the room today and to those of you joining us online as well. My name is Sonja van Rensen and I have the pleasure of moderating for you today. I've been a climate and environment journalist here in Brussels for close to 20 years now. And the last few years, I've also headed up a website called Energy Monitor, which is dedicated to the global energy transition. So in total, we've got over 340 of you joining today's international conference. And our conference organizers are HEAL, the Health Environment Alliance, which is the leading European non-profit working on environment and health, and the Mutualites Libres, which is a grouping of Belgian health insurers. The event also takes place under the auspices of the Belgian Presidency of the EU. So today's theme is Healthy Cities, Healthy People, Pathways for Clean Air in the EU's Urban Environment. Poor air quality remains a persistent challenge for cities the world over, but also here in the EU. In most of the EU, air quality is worse than what the World Health Organization recommends. Cities were built for cars, and whilst, at least in some places, that's starting to change today, air quality still suffers, and pollution is going up, for example, from more burning of wood, also as a result of increasing energy poverty. So what do we want to do here today? What we want to do is present some of the latest scientific research into air quality and health in cities. We also want to kick off an interactive discussion about how to engage stakeholders, notably at the local level, for cleaner air in the places where they live. And finally, we want to share some good practice and discuss the policy context a little bit with a view to looking at how to improve air quality further into the future. Ultimately, the goal is to make cities more breathable. The event couldn't be more timely. I'd say we have a vote coming up in the European Parliament tomorrow on the new EU Ambient Air Quality Directive, and we have elections just around the corner here in Belgium and at European level. So I'm going to stop talking in a moment, but a few very practical things before we get going. One, the conference is being recorded, so you will be able to look back at everything that's being said today. Presentations will also be shared with you after today's event via the websites of the organizers. We have interpretation, French, English, and Dutch. So if you want a headset, they're over there next to the door where you came in, so do go and get one if you haven't had one yet. In terms of channels, French is on channel 1, Dutch is channel 2, and English is channel 3. Finally, we want to, and we hope to have some time to take your questions also, so it shouldn't just be us up here doing the talking today. If you're in the room, you can obviously put up your hand. If you're following us online via Zoom, you can use the Zoom chat, and your question will make its way through to us. With that, I'd like to kick us off properly by handing over to three representatives who have helped make today's event possible. Xavier Brenet, CEO of the Mutualites Libres, and Anne Stauffer, Deputy Director and Strategic Lead at HEAL, represent our two organizers today. And thirdly, Anja Schneider is from the environment team at Bloomberg Philanthropies, who is also supporting today's event. So, all three of you can make your way up here and kick us off.
Well, ladies and gentlemen, good morning. It's a pleasure to welcome you to this conference, Healthy Cities, Healthy People. We are very lucky to have many participants. It has been said already, more than 300 from 33 different countries, which shows the wide interest in the topics we will discuss today. I have the privilege to represent the Mutualites Libres, the health insurance funds, independent health insurance funds in Belgium. We are the third largest group of health insurers in Belgium, with more than 2 million affiliates. And we consider environmental pollution as one of the 7 most important challenges for public health. Last year, we actually published a study on the impact on fine particulate matter on health, and The Guardian wrote an article entitled Why a Belgian insurer studies the impact of air pollution on health. And you may also ask the question, why are we so concerned about the air quality? Well, the answer is very, very straightforward. We have a Mutualites in Belgium, a broad mandate to promote health, improve health of our affiliates. Obviously, our main task is the evolution, the organization of the healthcare systems. But evidence shows that 20% to 30% of our health is actually determined by the healthcare system. We can add 10 to 20%, which is determined by genetics. And the remainder, which is actually more than 50% of our health, is dependent on the way we're living and the environment. We know that air pollution is one of the main environment risks impacting health, and a very important cause of chronic diseases and early death. So that's why we are so much concerned as a Mutualites about air pollution, and we want to act and be active on this domain. And we clearly want to lobby, we want to make promotional campaign, and also we do some research projects. And this is why you will discover later today the first result of our new study on low emission zones in Belgium. It has been said already, the timing is very good. Tomorrow there is debate and a vote at the European Parliament about the revision of the directive on air quality standards. But the debate is also going on in Belgium. We are on the eve of general elections early June, and there is debate on how fast and how hard we should push for initiatives to improve air quality in cities like Brussels. So this is a concern for Belgium, like in other countries. Air quality has been improving the last 20 years, which is positive, but there is still a lot of work to be done. When we compare our country to other countries, we have actually poor standards as it comes to air pollution. And we have more and more evidence that air quality has an impact on physical health, mental health, and obviously on the cost of the social security. So this means, and I guess I'm not the only one who will say that, we need to act differently, we need to have a long-term vision, we need to have determination, we need accountability at all levels, and we need global planning to make things change. So it's not only important now, in the view of elections, it's important that we continue to strive for better air quality after the European election and the Belgian elections. And we have to be inspired by the many citizens and the many cities who are already committed to this goal. Before turning the mic, I would like to thank our partner, HEAL and Environment Alliance, for the great cooperations in preparing and realizing this event, and also Bloomberg Philanthropies for their support. It is thanks to such professional partners that we can organize events like this today. So I wish you all an inspiring and fascinating morning, and I thank you.
Good morning, everyone. A warm welcome also from, on behalf of my organization, HEAL, the Health and Environment Alliance, to all of you joining this morning, those of you in the room and those of you joining us virtually. It's wonderful to see all of you here. It was mentioned over 340 registrations, which shows the great interest, but also the great concern in the topic that we will be talking about here this morning on how to reach clean air for health in the EU's urban environments. My organization, HEAL, is an alliance of over 80 member organizations working for better health through a healthy environment. and actually achieving clean air everywhere, inside and outside, across the European Union, across Europe, and for everyone, but especially for those most vulnerable, has been at the core of HEAL's mission since we were founded over 20 years ago. And together with our members and partners, HEAL has worked continuously to raise awareness on how air pollution affects health, and actually that air pollution is the top environmental threat to our health across the European Union, also at very low levels, and it's a major risk factor for all chronic disease. We've also worked to communicate the latest science, and actually there's a huge body of evidence out there on how poor air quality affects health. There's no scientific doubt that it harms and it's a threat, even at very low concentrations. And together with members and partners, we've also advocated for clean air action, for urgent action, not only at the city level, but actually across all of the different levels that need to be involved, so the regional, the national, and also the EU level, as we all need to work together to make clean air for health a reality. Today, in fact, there are a record number of health organizations active on the topic, and we're pleased to see so many of our partners and our members from the health community here in the room, including obviously the independent health insurance funds as one of our dear members. But I'm also delighted to see the partners from civil society, the partners from the science, and also the representation from cities themselves and city networks, who've, cities have in the past years continuously worked on this topic as well, and we hear more about good practice in the course of this morning. It was mentioned already, but I do want to stress it again, that this conference takes place on the eve of a key vote in the European Parliament tomorrow, as the EU is on the finish line to update the ambient air quality directives with a trilogue deal package that's on the vote with MEPs tomorrow, a deal that regrettably, this compromise falls short on fully updating to what the science says and the scientific recommendations. But nevertheless, the package on the table has a huge potential to lessen people's suffering, to prevent disease, and to achieve economic savings, considering the significant health costs that we still have across the EU from poor air quality. HEAL urges all MEPs and actually all member states to adopt this revision ahead of the EU elections, as this is an updated law with a clear added value for people. This is what we're talking about. We're talking about people's health, and this has a clear added value. And we'll also talk more today on how and why this updated EU law can actually help cities to initiate further measures at the urban level. So there's a lot to talk about, so I don't want to, take more of your time, but end with some thank yous. First of all, thanking the Belgian EU Presidency, as this is a conference taking place under the auspices of the Belgian EU Presidency. I would also like to gratefully acknowledge the financial support from the European Union, the ClimateWorks Foundation, and Bloomberg Philanthropies for this conference. And last but not least, I would like to thank very much, and you're now behind me, Xavier, I would like to thank very much the independent health insurance funds for the great working together and the cooperation in making this conference possible. And I wish us all fruitful exchanges and look forward to this morning's debate. Thank you.
Bonjour à tous, bonjour Monsieur le Ministre. Merci d'être là si tôt le matin. Good morning, everyone. I'll spare you from speaking French, so I'll do it my English, so forgive me. I'm Anja Schneider. I'm responsible for the European Environment Program at Bloomberg Philanthropies. And for those not familiar with our work, so our work encompasses all of Mike Bloomberg's personal and corporate giving and the foundation. And our environment program is at the forefront of global climate efforts and also to protect the environment. So we work on themes such as the energy transition, but also trying to end reliance on coal and supporting some cities, including Brussels, but Warsaw, in their efforts to cut pollution. Our founder, Mike Bloomberg, has long been a leader in the fight against climate change during his time as mayor of New York, but also now he serves as the UN Special Ambassador for climate ambitions and solutions. Air pollution is an urgent crisis. I don't need to tell you that. But many of the causes of air pollution is the same causes that cause climate change, and also are responsible for some of the public health threats. Today, according to the WHO, 99% of the world's population breathes dirty air. That means that 7 million people every year die due to causes of air pollution. In a time where air pollution and climate change are often weaponized, and especially ahead of elections, I think it's more critical than ever that mayors, that partners like yourselves, the health sector, NGOs, academia work together to stand in front of ambitious policies. We have seen often the backlash against, for example, the ultra-low emission zone in London, but also recently in Brussels, with people wanting to delay some of the ambitious policies that Brussels wants to take. But we have seen the same in Warsaw, Rome, Milan. So I think now it is important for people like you and I to stand firm and also support people who are trying to make a change and to make our cities more livable. Here in Brussels, just recently, 140 health and environment experts came together to stand and to call for strong measures to fight air pollution in Brussels. Our work and engagement at Bloomberg Philanthropies on clean air builds on Mike's legacy as mayor of New York, because during his time, he also stood up and tried to decarbonize the domestic heating to make the air cleaner in the city, and he was very successful during his mandate, leading New York to have the cleanest air in 50 years, but also improving life expectancy by 3 years for New Yorkers. Our role at Bloomberg Philanthropies is supporting some of the cities, but also some of the partners here in the room, to engage at city level, but also to fight for policies for improvement and mobilize support through stronger data and evidence, public health awareness, policy engagement, and peer-to-peer learning. Our partnership with Brussels Capital Region and Minister Marron here, that was launched in 2020, supported an ecosystem of partners, including some here in the room, with projects like Curieux en Air, for example, that mobilized 3,000 citizens to measure air pollution at a local level, to better understand the implications of air pollution, but also to understand the air that they were breathing. And then we used the findings to advocate for cleaner policies, but also to better understand what local air pollution was like. Today, Brussels is also part of Breathe Cities, and this is a program that we run together with the C40 and the Clean Air Fund to support cities, and mainly in emerging and developing countries, but we also have some European cities, to strengthen their air quality management, to also support research that will show the impacts of air pollution, but also some of the policies that have been taken, like school streets, for example, or low emission zone. Today, I'm so happy to see so many of you in the room and interested in this topic, and hopefully each of us, in our own way, are able to support the work that cities and other city authorities are doing to fight for cleaner air. Thank you so much.
Thank you very much to all three of you for a very clear introduction. So more than 50% of our health depends on how we live and the environment. Air quality is the top environmental threat to health. Many of air pollution's causes are also causes of climate change, and at the same time, although air pollution kills some 7 million people a year, we think, the world over, it has become an extremely political, controversial issue, and hence, in a follow-on to some of the campaigns and work that has already been done, one of the focus areas for today is also to discuss how we can engage citizens to care about and to act and to support actions to clean up urban air. So we're going to move on to two keynotes. Before that, two more practical points. One on accreditation. We have some doctors, both in the room and joining us online today. If you're a doctor, you should have shared your accreditation details earlier in the lobby. Don't forget to do it again at the end of this conference. If you're a doctor attending online, your online presence has been monitored and registered. And at the end of the conference for you, please send us the documents that you will find on the connection page, and that will ensure that your accreditation is correctly booked. Finally, we do have a hashtag for those of you keen to share, and hopefully many of you are, comments, thoughts, reflections on today's event. The hashtag is up there on the screen, Clean Air for Cities. So do use X, formerly as Twitter, LinkedIn, other social networks. And that's it for housekeeping. So I'd like to introduce our first keynote, Patrick Child, who joins us from the European Commission, where he's Deputy Director General at DG Environment. He's responsible in particular for the EU Zero Pollution Strategy, chemicals policy, research and innovation for the environment, and communications in that space. And previously was Deputy Director General for Research and Innovation, and has long had a focus on climate action, clean energy, clean mobility, and so forth. Patrick, looking forward to hearing a little bit about what the EU has achieved and hopefully a thought on what's next.
Well, thank you very much, Sonia. Minister Marron, ladies and gentlemen, I'd like to start by thanking HEAL, the Mutualites Libres, and the Belgian Presidency for organizing this event. And I feel deeply honored to be able to sort of kick off the discussions at this gathering of European and urban decision makers, health stakeholders, scientists and civil society representatives, as we convene to discuss the critical topic of sustainable mobility and its profound impact on public health, but also its relevance for economic prosperity. And we are therefore presented, I believe, with a unique opportunity to showcase the transformative power of collaborative action on air quality. And as we meet against the backdrop of the upcoming 2024 European elections, also elections in Belgium, of course, and then the next institutional policy cycle from 2024 to 2029, it's a particularly good moment, I believe, to be taking stock of the progress that we've seen and the very important progress in recent years, but also to work together to identify future pathways to ensure good air quality for everyone, everywhere, and in particular in our cities. And I think we all recognize that this does require a collective, collaborative effort by all relevant stakeholders. And that's why I'm so encouraged to see such a strong participation in the meeting today. And I'd like to share, perhaps just concentrate on three main messages. Firstly, to say a word about the importance of our action on clean air under the European Green Deal, particularly in our cities. Secondly, to sort of demonstrate, I hope, that the Commission has, with the support of the successive presidencies and working with the European Parliament, delivered a significant amount of new legislation to address these challenges. And then finally, to say a few words specifically about how this resonates and affects the work that we're doing in cities. So, to start, I don't think I need to underline strongly enough the critical importance of clean air and healthy urban environments as a fundamental dimension of the European Green Deal. The Green Deal is a multifaceted strategy to ensure sustainable development aimed at achieving climate neutrality and nature-positive Europe, while significantly reducing air, water, and soil pollution. And central to this vision, and indissociable from it, is our steadfast commitment to realizing zero pollution, ensuring a toxic-free environment for present and future generations. As Anja mentioned a moment ago, I mean, this is an indispensable and indissociable link with our broader agenda on climate, in particular the huge progress that we've made under this Commission on the Fit for 55 agenda. I'd stress, though, as well that the work that we're doing on zero pollution, climate, and more generally on the green and digital transition is not only about a strategy on paper, new legislation. You know, we also, at the European level, back up these commitments with massive financial support, both from the EU budget and also from the Next Generation EU post-COVID recovery funds. And that's helping us to make a real difference in the way that member states and local communities, cities are able to address and embrace the challenges of reducing pollution, and in particular on clean air. Clean air, I think, stands as a real sort of focal point of the work that we're doing to address the health, respiratory, cardiovascular diseases, which are exacerbated, as we know, by particulate matter and nitrogen oxides in our air. And despite the progress that many member states have been making, we see that poor air quality remains a really strong and environmental and public health concern in many member states, with still a distressingly large number of premature deaths attributed to air pollution annually. Which affects particularly urban areas. And so it's right that we are looking at that in particular. And so my second message is that we have made, over the last few years, in particular the mandate of the Commission led by President van der Leyen and with our Commissioner Virginijus Sinkevicius, huge progress in delivering on a very ambitious range of legislation, and I won't go through the full checklist, but you know, particularly I was very happy to be part of the negotiations on the revision of the ambient air quality directive, and like others, delighted that we are now so close to the finishing line of having the adoption of this important text by both the Parliament and the Council. And I think that you know, the new directive puts us very much on a clear path to alignment with the WHO standards, while allowing, I think, some necessary flexibility, derogations for member states to make the necessary changes and adjustments, particularly in specific areas that are affected by heavy industry or historical pollution coming from domestic solid fuel or other fossil fuel heating systems. But we also put a lot of emphasis on improved modeling and monitoring, vitally important also to ensure that we improve public information about the air quality situation in areas that they're living in, as well as stronger provisions on enforcement, including penalties for non-respect of the directive. So I'm very confident that together with other important pieces of legislation, in particular the Euro 7 standards for emissions from vehicles, that we are in a good place to look forward to continued improvements in air quality in the years to come. Transport, of course, is a very important dimension of the sources and causes of air pollution, and therefore has been a particular focus of our work under the European Green Deal, where we have set very ambitious targets to reduce pollution from motorized transport, particularly in urban areas, prioritizing sustainable transport modes, walking, cycling, and clean and sustainable public transit. We have therefore taken, as well as the legislative initiatives, also policy frameworks like the Smart and Sustainable Transport Strategy and the EU Urban Mobility Framework, and highlight just also recently a very positive development with a joint declaration from Council, Parliament and the Commission on urban cycling. So, a lot going on around the delivery and implementation of air quality under the European Green Deal. But I'd like now, just in the few moments I have left, to make a specific focus on the work we're doing to support cities on this agenda. And so we have initiatives like the European Green City Accord, which is a sort of a voluntary agreement that cities can enter into to empower them to make measurable progress on environmental targets, a broad range of targets, promoting collaboration and knowledge sharing among urban centres, but covering pollution, the circular economy, and biodiversity promotion of green spaces. And the Green City Accord is, I think, the place where all of our climate and environmental challenges in cities come together. So delighted to see that we have so many cities across the European Union as part of that. And for particular cities standing out, we also have the annual European Green Capital, European Green Leaf Awards, where cities compete, and it's a very intense competition to get the annual titles for these important awards. And air quality is one of the things that we look at in particular in judging which cities are best placed to receive those awards. I'm also very happy to be addressing you today in my capacity as mission manager for the European Union mission for smart and climate neutral cities, an initiative supported by our Horizon Europe Research and Innovation Framework Programme to help 100 cities across the European Union to become climate neutral by 2030. Very happy that we have 4 Belgian cities part of the initiative. I was just last week at a very dynamic event to receive the plans of the Brussels region capital for the Climate City contract that they have prepared, but also we have Leuven and Antwerp well advanced, and looking forward also to seeing plans from La Louvière. The work that we're doing through the mission, again, although focused on achieving climate neutrality, demonstrates very clearly that in order to get where we want to on climate neutrality, we need to make progress on the full range of environmental challenges, including pollution and air pollution as a part of that. And that's why under the mission's work programme for 2024 that we've recently presented, there is a specific call for proposals for 20 million euros covering zero pollution in cities, addressing air, water, and noise pollution. So I encourage you to look at that. Looking for the future, I think we still have a very challenging agenda ahead of us, but one which holds immense promise and responsibility. We are, in the next mandate, I guess, going to shift very much from the design and negotiation of new legislation to implementation and action. And there, I think that the work that we do through cities is going to be vitally important. Because, as we know, 72% of the EU population lives in our cities, and the cities are a major part of both our greenhouse gas emissions and also source of pollution. So we do need to continue on this important agenda. And so, ladies and gentlemen, in concluding, let us embrace the opportunities presented by the European Green Deal, work together to leverage the EU support that we can in collaboration to build healthier, more resilient urban communities. The Commission, I'm sure, will remain strongly committed to this objective as we shift into the new phase of implementation of the European Green Deal, and cities will be crucial to our success. But I believe that together we can forge a path towards a zero pollution future where cities and municipalities thrive as examples of sustainability and prosperity. Thank you very much.
Thank you very much, Patrick. Clean air, a fundamental dimension of the European Green Deal, huge progress on legislation these last few years, notably on the revision of the Ambient Air Quality Directive. We're now on which puts us on a clear path to alignment with WHO standards, albeit with the necessary flexibility in cases where that is warranted, notably if there's a legacy of fossil fuel domestic heating systems, for example, and various initiatives around cities, specifically the Green City Accord, the European Green Capital Awards, which look at air quality in particular, and the Smart and Climate Neutral Cities Initiative funded by Horizon 2020. And cities too, indeed, will play a vital role, you said, when it comes to more action and implementation, that focus which is expected in the new political cycle in particular. We don't have any time for questions, I'm afraid, so sorry about that. Do approach Patrick. I don't know if you'll be around if you want to put anything to him a little bit later this morning. I'd like to move to our second keynote, Alain Marron, Minister of the Government of the Brussels Capital Region. He's in charge of climate transition, energy, environment, social affairs, and health. He's a member of the Belgian Green Party, was a member of the Brussels Regional Parliament for 10 years prior to his current role. And environment and health is a particular area of focus for him. Both of those fall under his portfolio, and the linkages between those two is also something that he has tried to integrate into his work. Bienvenue, et the floor is yours.
Hello everyone. I'm very proud and glad to be here today. Just as it was said, I'm Minister of Health and Environment, so I know perfectly well that it's not possible to have a healthy population without a healthy environment, especially in air quality. Air quality is the perfect example of the link between health and environment. So I understand perfectly well why les Mutualites Libres are working on this topic. And I would like to thank you anyway for your commitment about that and for the commitment of all the people here, because it's very, very, very important for us to feel that there are many people thinking in the same direction and who are really ready to go further. My speaking notes are in French, so I will go through it in French. So don't hesitate to use the direct translation. There are headsets over there, I think. So I'll go further in French. Et donc oui, respirer un air pur, c'est totalement essentiel pour la santé, c'est totalement essentiel évidemment pour la qualité de l'environnement. La pollution de l'air, ça reste le problème environnemental numéro 1 en Europe, dans les villes et ailleurs. C'est le problème qui produit le plus de soucis de santé et de conséquences négatives de santé. Des centaines de milliers de décès prématurés sur le continent, des maladies respiratoires, des maladies cardiaques, cérébrales, et tout cela touche évidemment en particulier d'abord les personnes les plus vulnérables, les enfants, les personnes âgées, etc. Ça affecte évidemment aussi les environnements généraux, les écosystèmes, et ça entraîne des coûts économiques importants, ça vient d'être dit, entre autres pour nos systèmes de santé. Il est important donc d'investir pour améliorer les conditions environnementales et améliorer la qualité de l'air, pour offrir le droit à chacune et chacun de respirer un air pur. Et pour y parvenir, on doit agir ensemble avec ambition et avec conviction. Et donc je suis content de vous voir nombreux aujourd'hui pour discuter de ce sujet crucial. Je suis aussi content d'avoir pu faire avancer sous cette législature très concrètement ce dossier ici à Bruxelles, mais aussi dans une certaine mesure au niveau européen. Alors, je vais mettre en évidence quelques points. D'abord, je tenais à souligner l'importance d'agir ensemble pour lutter contre ce problème majeur de santé publique. La pollution de l'air, elle ne s'arrête pas aux frontières administratives. Une action transfrontalière forte profite à toutes et tous. Il est donc évidemment important d'avoir un cadre européen qui soit le plus clair et le plus ambitieux possible. C'est la raison pour laquelle les avancées engrangées dans le cadre du Green Deal européen sont évidemment importantes. Il vient d'y être fait référence. Alors, ces dernières années, il y a eu fixation de standards clairs en direction d'une décarbonation du parc de véhicules. On réduit drastiquement l'utilisation du fossile dans la production industrielle et dans l'énergie. Il y a une accélération du déploiement de sources d'énergie renouvelables et un nombre croissant de villes européennes se dotent de zones à faible émission. C'est aussi grâce au cadre européen, il faut le dire. Sans le cadre, moi je le sens comme ministre régional, dans une multitude de politiques que je mets en place et que je peux mettre en place, l'ambition qui est fixée, la capacité à fixer un cadre ambitieux découle aussi du cadre européen et des objectifs européens. Nous avons besoin d'un cadre clair et ambitieux. Nous en avons besoin maintenant et nous en aurons besoin encore pour le futur. Plus récemment, j'ai eu le plaisir de coordonner les travaux du Conseil sur la révision des normes européennes en matière de qualité de l'air. Il vient d'y être fait référence aussi. C'est un travail complexe, mais important. Il y a eu de nombreuses tractations, vous le savez, puisque les points de vue étaient quand même fort différents entre le Parlement, le Conseil, la Commission. Ceci dit, il y a accord sur un texte qui doit nous permettre d'aligner notre législation le plus rapidement possible avec les recommandations de l'Organisation mondiale de la santé. Et là encore, ce texte, cette nouvelle directive, qui va donc être votée au Parlement dès demain, si je touche du bois, parce que depuis Nature Restoration Law, j'avoue que je suis plus prudent sur l'approbation des textes européens, mais normalement, donc, ce texte devrait être approuvé au Parlement et puis ensuite au Conseil le plus rapidement possible. Il nous aidera. Il nous aidera. Il aidera les personnes qui, comme moi aujourd'hui, sont ministres de l'Environnement et ou de la Santé dans une région ou dans un État. Il nous aidera à avancer sur des mesures concrètes supplémentaires. C'est extrêmement important. Je tiens à le souligner quand même au moment où d'aucuns remettent parfois en question même l'utilité de l'Union européenne, le sens que ça peut encore avoir, le fait que les États peuvent se débrouiller tout seuls. Bien souvent, en environnement, sans le cadre européen, nous serions moins loin que nous sommes aujourd'hui. Les impacts de ce travail sont déjà visibles, ce dont je me réjouis, mais évidemment, l'heure n'est pas à une pause environnementale. L'heure est à la mise en œuvre des accords ambitieux déjà existants qui nous portent pour les prochaines années, des objectifs climatiques 2030, 2040, 2050, des objectifs environnementaux généraux. Et donc, la mise en œuvre de ces accords, mais donc nécessairement aussi une amplification des politiques climatiques et environnementales. Il y aura des politiques climatiques et environnementales plus fortes dans 5 ans et dans 10 ans que celles d'aujourd'hui. Tout simplement parce que c'est indispensable pour atteindre les objectifs que nous nous sommes communément fixés. Et donc, il est illusoire, voire mensonger, de faire croire qu'il pourrait être question d'une pause, ou en tout cas, alors, ce serait dramatiquement irresponsable. Deuxièmement, vous le savez, le rôle des villes est crucial dans la transition environnementale. En matière de pollution de l'air, les villes sont génératrices de polluants atmosphériques, mais elles sont aussi les premières victimes. Elles concentrent les populations, souvent les populations les plus vulnérables, mais pas seulement. Elles concentrent les populations. Heureusement aussi, elles concentrent les solutions. C'est en ville qu'il y a le plus de transports en commun, par exemple, où les réseaux sont les plus denses. C'est aussi en ville où c'est le plus simple de se déplacer à vélo ou à pied. Très franchement, le vélo, c'est mon moyen de déplacement quotidien. on va dire, dans 90-95% de mes déplacements, même en tant que ministre. C'est pas juste parce que je suis un écologiste, c'est aussi parce que c'est le plus pratique. C'est ce qui me permet d'arriver à l'heure à mes rendez-vous dans un agenda chargé. C'est le vélo, en fait. Parfois la marche à pied aussi. Et donc, effectivement, les villes, elles concentrent ce type de solutions. Et donc, les villes doivent montrer l'exemple et récoltent d'importants bénéfices d'une transition environnementale, entre autres vers un air plus pur. Ici, à Bruxelles, en termes d'environnement et de climat, de nombreuses mesures ont été prises ces dernières années. On a rehaussé nos objectifs climatiques, notamment parce qu'il y a le Green Deal, et il y a une rehausse des objectifs dans le cadre du Green Deal. Ça nous a poussé à augmenter nos propres objectifs climatiques et toutes les actions derrière. Nous avons adopté une stratégie ambitieuse de rénovation du bâti. Nous avons augmenté les budgets et les soutiens de manière drastique. Nous avons encore augmenté aussi les budgets sur les transports en commun. Ici à Bruxelles, c'est quasiment 20% du budget de cette région pour avoir un réseau de transport en commun qui soit le plus efficace possible. Nous avons augmenté en 5 ans plus ou moins de 15% l'offre de transport en commun ici à Bruxelles. Je permets de le dire parce que souvent les gens ne s'en rendent pas compte. Mais dans cette ville, il y a plus de trams, plus de bus qu'avant, ils roulent plus, ils sont plus fréquents, ils sont plus modernes, ils sont plus confortables et par-dessus le marché, ils sont moins polluants qu'avant. Nous avons aussi fixé un cap clair vers une sortie des véhicules thermiques à Bruxelles avec la Low Emission Zone version 2, les étapes de 2025 à 2035 et au-delà. Toutes ces décisions sont prises et sont ancrées maintenant dans la législation, avec donc un cap et une prévisibilité à long terme, à moyen et à long terme, ce qui est extrêmement important. Un certain nombre de résultats sont visibles à Bruxelles. Je ne suis pas en train de dire qu'à Bruxelles tout est parfait, rassurez-vous. Néanmoins, des résultats sont visibles. Le nombre de cyclistes a explosé. La zone de basse émission a permis de réduire les concentrations d'oxyde d'azote de plus de 30% sur les principaux axes de la ville en 4 ans, par l'exclusion des diesels Euro 4. Et aussi d'importantes réductions d'émissions de gaz à effet de serre sont observées dans le secteur des bâtiments, de l'ordre de 40 à 50% de réduction de nos émissions ces dernières années. Et pour la première fois, ces toutes dernières années, on a une réduction des émissions dans le secteur du transport. Ça n'est jamais arrivé depuis 1990, mais ces toutes dernières années, nos émissions de gaz à effet de serre diminuent dans le transport aussi. On est encore loin, ceci dit, d'atteindre les objectifs. Les recommandations de l'OMS sont encore loin aussi en qualité de l'air. Elles ne sont pas atteintes. Et il y a encore de grandes disparités environnementales d'un quartier à l'autre de la ville. Je conclus donc mon intervention sur un point. Pour y arriver, nous ne pouvons y arriver qu'ensemble, en incluant la population et les parties prenantes. Si nous voulons amplifier nos politiques, il n'y a rien à faire. On doit les faire en alliance et en articulation avec les ONG, avec les citoyennes et les citoyens, avec un certain nombre de médias et de partenaires, avec les administrations, avec le secteur privé. Nous avons lancé une multitude de partenariats sur la qualité de l'air avec Bloomberg, que je remercie encore, et tous les partenariats et tous les partenaires qui sont dans le partenariat qui a été établi. Mais nous faisons de même aussi sur la rénovation du bâti, sur nos objectifs climatiques. On essaie de travailler ensemble. C'est ce que je nous souhaite. Je vous souhaite aujourd'hui une journée qui va vous permettre des apprentissages et des collaborations fructueuses et qui nous permettent d'avancer ensemble et en partenariat vers un avenir qui soit meilleur. Merci encore aux organisateurs de cette journée et bonne journée à toutes et tous.
Merci beaucoup. Thank you very much. Once again, a very clear speech. You emphasize the value and the necessity of a bigger framework, a European framework, and explained that is crucial in setting the scope for ambition at the local level as well, and that the new air quality directive will help. However, it's not time to rest on our laurels, because we have jointly committed to long-term goals that will require stronger climate and environment policy going forward. And finally, cities, the biggest cause of air pollution, the biggest victim of air pollution, but also the place where there are solutions. And a few examples, the buildings renovation strategy here in Brussels. And I think you said 20% of the city's budget goes to public transport, and the offering of that has grown by 15% over the last 5 years. So some very significant results of that investment as well. Thank you. We turn now then to a series of presentations. We've got 5 presentations. I know we're running behind, so we'll see if we have time for questions after those, or whether we simply break for coffee after those and you don't mob our speakers, but you approach our speakers as they're queuing for coffee and put your questions to them in the queue. But 5 presentations, which are intended to give you a flavor of some of the latest scientific research out there about air quality in cities. And we're going to kick off with Alberto González Ortiz, who worked for the Spanish Ministry of Environment for several years with a focus on air quality. He's now with the European Environment Agency as a project manager on air quality data and policy assessments. Has been doing this for more than 10 years now. And so he works on European assessments of air quality indicators, air pollution country fact sheets, and of course the air quality directive. The floor is yours.
Thank you, Sonia, for the introduction. Good morning, everybody. As you have heard, I'm Alberto González. I work as air quality expert at the European Environment Agency, and I would like to thank the organizers for the opportunity to present the work that we do at the European Environment Agency on air pollution, with a focus especially on cities. So that's what I'm going to present. To start with, I would like to show you the main emission sectors we have. So here you can see for each pollutant, which are the main economic sectors that contribute to emissions of this pollutant. And if we focus on the ones that happen mainly in cities, which is the residential, commercial, and institutional, that is basically the combustion for heating, and the road transport. This doesn't mean that these sectors don't happen also in other environments as rural environments, and also that other sectors as, for instance, industry don't happen also in cities, but these are the main ones. And if we focus on the residential, commercial, and institutional, is the main sector contributing to emissions of benzoapyrene, particulate matter, both PM10 and PM2.5, black carbon and carbon monoxide. And if we look at the road transport, this is the main contributor to emissions of nitrogen oxides, and also an important contributor to black carbon and carbon monoxide. So having this in mind, and also the concentrations, I will focus mainly on PM and particulate matter and nitrogen dioxide in the rest of my presentation. So here you have the situation for the last year for which we have at the agency validated data. In the map you can see monitoring stations representing annual mean of nitrogen dioxide. And the points that are in red mean points where the concentrations are above the European Union annual limit value. Those in light blue are stations with values below the recommendations by the World Health Organization. So we see that this is for all stations. About 2% of the stations have values above the limit value. And this happens all along Europe. And you can see that, I mean, maybe you can identify in the map the main cities, the most polluted cities, the more traffic cities. If we focus only on the urban stations, so we have removed in the second map the rural stations, we see exactly the same red dots. So this means that the highest values of nitrogen oxide happen in cities and mainly linked to traffic. The situation is similar for PM2.5. So again, you see here red dots in stations with values above the annual limit value. You see as light blue stations that comply with the recommendations by the World Health Organization. You see that are very few, with values below this 5 micrograms per cubic meter. And again, if we focus on only the urban stations, we see that this happens mainly at urban environments. And in this case, the highest concentrations happen mainly in Eastern Europe and Northern Italy, and this is linked to the residential heating, the combustion of solid fuels especially. Another way of looking at the situation in European cities is with another tool we have at the agency when we present the concentrations for particulate matter, fine particulate matter at city level. So what you see here in the map as colored dots are not stations but cities. So we present information for about 400 cities, and we present an average of the concentrations for the previous 2 years. And we can see again that very few cities have values below the World Health Organization recommendation, and these are mainly Nordic cities. We also see the cities with the highest concentrations, again, in Northern Italy and Eastern countries. And if we click on individual stations, here you have the example of Brussels that perform like in the middle of the table. It has an average concentration of 10.5. And when you click on the cities, you can see also the stations that have been taken into consideration for the calculation. The main result of these high concentrations is, of course, the exposure of population to these concentrations that in many cases are harmful for health. And here you have the results of an indicator of the agency when we present the percentage of urban population in the European Union living with concentrations above the air quality standards defined legally by the European Union, to the left of the slide, and living in concentrations above the recommendations by the World Health Organization. And you can see here the huge difference, which obviously is the result of the differences in the levels. This will be solved partially with the approval of the new Air Quality Directive. We have heard that tomorrow there will be this voting in the European Parliament. But what we can see here is that if we look at the right part of the slide, that almost everybody living in a city is exposed to concentrations of fine particulate matter and ozone that are considered harmful by the World Health Organization. But even if we look at the European Union legal standards, we see that still, even if these values are in force since 2005, a lot of people, like around 10% for particulate matter, live in rural areas, in urban areas where concentrations are above these legal standards. So the most important consequence of this is the impacts on health. The most serious is the mortality, and we also estimate at the European Union, and this is not only for cities, this is for all the population, the deaths attributed to exposure to concentrations above the World Health Organization recommendations. So we estimated that in 2021, in all the European countries considered, 293,000 deaths were attributed to exposure to concentrations above these 5 micrograms per cubic meter, which is the World Health Organization recommendation. If we focus on the European Union, we estimated 253,000 deaths. And as I said, this is at country level, at aggregated at European level, but also at country level. And in the map, you see the situation normalized by population. And here, the countries that have darkest blue are countries that have relative highest mortality, and not surprisingly, this happens in those countries where we have seen that we have the highest concentrations. You can also see the situation at city level. So we provide information on the mortality estimated at city level, and you have the information in the source presented in the slide. I know that my presentation maybe is a bit packed, but I wanted to show you all the information that we have at the European Environment Agency. Of course, you will have the presentation afterwards, and you can go into the links and you can have a more detailed view of all this information. So last year we presented also for the first time not only information on the mortality, but also on the morbidity, which is the other aspect of the burden of disease due to exposure to air pollution. And you see here for several diseases, the contribution of both the mortality and the morbidity to the burden of disease. And we thought this was important because including morbidity gives a most accurate picture of the impact of air pollution on health. And you see, for instance, that there are some diseases where the most important part of the burden of disease is mortality, as for instance the ischemic heart disease or the lung cancer, but there are all other diseases for which morbidity, that is the condition of living with, the state of living with this poor condition a long life is also important, especially for asthma. So if we really want to take into account all the impact of air pollution on health, we cannot only look at mortality, we also need to look at morbidity. The good news of all these things is that the situation has been improving along the years. And here I present the results of a study carried out last year. And you can see the whole study at the link in the slide. Here I present the situation for all stations measuring nitrogen dioxide from 2005 to 2021. And you see the stations grouped by typology. So the black line corresponds to the traffic stations, and you can see a decrease of around 40% from the first year, 2005, to 2021. You can also see in the red lines that the urban stations, these are the urban background stations, have also reduced their concentration. And if you look at the map, at the station level, we see that almost every single station has a decreasing trend, and in some cases, it goes up to 1 microgram per cubic meter per year of reduction. The same happens if we look at PM2.5. So again, you see here in the upper graph, the red line, which corresponds to the urban stations. In this case, the reduction is about 50%. And in the map, we again see that for almost every station, we see a decreasing trend, almost up to 1 microgram per cubic meter per year again. This improvement, it has been also translated in the improvement of the health impacts, and here you see the evolution of the mortality attributed to exposure to PM2.5 above 5 micrograms per cubic meter. So we have the starting point 2005, we have the final point 2021, and we see a decrease of 41% on the amount of deaths attributed to PM2.5. And this indicates that we are in path of achieving the Zero Pollution Action Plan objective of reduction of 55% by 2030 of the mortality attributed to PM2.5 in relation to 2005. In any case, even if we reach this objective, we will have around 200,000 deaths attributed to PM2.5 every year. So reaching the political objective doesn't mean that we are in an optimal situation. The improvement is the result of the implementation of measures at different levels, of course at European level, but also at regional and local level. And here on the slide, you have the link to a briefing we published 2 years ago when we analyzed some of the measures implemented. Of course, most of them are targeting traffic and residential heating, which are the main sources of the pollutants in cities. You have several examples, and I think we will hear afterwards on some of them. Implementation of low emission zones, promotion of clean public transportation, shift on transport mode. When it comes to residential heating, the ban of certain fuels, the shift of boilers, the promotion of renewable energies, but also we have some actions that target the urban space. So we have a redefinition or a rethinking of the urban space. I would also like to focus on an aspect of air pollution, and this has to do with the unequal exposure and the unequal impacts. So on the map, you can see the yellow to brown colors are the situation in terms of socioeconomic of the different regions in Europe. So they are grouped by quintiles, and you see the gross domestic product per capita. So the lightest color indicates the wealthiest regions, and the darkest color indicates the poorest regions in terms of this income. And overlaid, you can see this pattern with the quintile of the most polluted regions, and you can see a spatial coincidence towards eastern of Europe of the most polluted and the most deprived regions. And if we look at the evolution along the years, you can see here the data of an indicator, when we can see the average of all the concentrations for the most deprived regions and the most and the less deprived. So we can see that systematically there's a gap between, the wealthiest regions are exposed to lower concentrations than the poorest regions, and this situation is maintained along the time. This is the result also of the fact that there's no indication in the legislation that asks to address these inequalities. This will change also with the implementation of the new Air Quality Directive. And finally, I just wanted to highlight you in a product that was issued last year at the agency is the Environmental and Health Atlas, when we present the situation for several environmental risks. So you can find maps with information on air pollution, environmental noise, green spaces, the inequalities in exposure that I presented before, and also a widget called Check Your Place, where you can go to a location, and what I present here is the venue of this conference, and you have information on the concentrations, you have information on the noise, and you can see here the contour noise maps, and you can also find some information on the local environments, for instance, distance to green spaces that we know it's a factor for mental health. You see also the distance to public transportation or the distance to local hospitals. And with this, sorry for being maybe a bit fast, but as I said, you can find all this information in the links that are provided in the presentation. Thank you very much.
Thank you very much for that. Yeah, as Alberto said, his presentation has a lot in it, and we will be sharing that, so you can go back and have a look at some of the detail in that after today. Pollutants we focused on, NO2 and PM2.5. Indeed, the greatest pollution is in cities. NO2 mainly traffic, PM 2.5, fossil fuel, also biomass, combustion heating in any case. And you see there's lots of information available looking both by pollutant, but also looking by city. In every case, the message is very much the same. These cities in Europe are far away from what the WHO recommends in terms of standards. Almost everyone is exposed to PM 2.5 and ozone levels that are considered too high. Information on the deaths attributable, but also other health impacts. And you'll see some illnesses up there like diabetes that maybe we don't often hear about in connection with air quality. The good news is that the trend is going in the right direction. And it's good to hear we're on track to a target, because often we're not on track. So on track to reducing premature deaths from PM 2.5 by 55% in 2030 compared to 2005. Still means 200,000 people are dying, but it's a lot better than what it is today. And the Environment and Health Atlas, where you can also go and look up your own region and see how things are doing there. Thank you, Alberto. Mark, impatiently waiting. Good. Save us a few minutes of coming up. Mark Nieuwenhuizen was going to talk to us about sources of air pollution and the benefits of improving air quality. He's looked at 1,000 cities. He's an expert in environmental exposure assessment, epidemiology, and health risk and impact assessment with an interest in healthy urban living in particular. Works for the Barcelona Institute for Global Health, where he's director of the Urban Planning, Environment and Health Initiative and head of the Climate, Air Pollution, Nature and Urban Health Program. That's all yours.
Thank you, Sonia, and thank you to the organizers. And I thought I already come up because then we save a little bit of time. We're behind it. Yes, thank you. So the work that I'll be presenting is part of our work on the Urban Burden of Disease project. UBD Policy, it's a project funded by the Horizon program, where we look at trying to improve the health estimations in cities in relation to environmental stressors, and also do some costing of those. We're working with a data set of 1,000 cities, for which I'll be presenting some results. And also we've got some case city studies where we do some more in-depth work, looking at the interventions that are taking place or may be taking place, and see what are the related health benefits of those, and also the costing of those. Brussels is actually one of our cities that we're interested in and also working with. The consortium is relatively small and includes only 6 partners, including HEAL, the organizer for here. And the project started in January in 2023. This is kind of the framework where we're working under. I mean, that the idea is that, urban design, urban mobility, environment, and health are all related to each other. So how you design a city is how people get around the city, how this leads to environmental exposures and then to disease. I mean, if you invest and design a city for cars, you get a lot of cars, you get a lot of air pollution, you get lots of noise, not as much physical activity, leads to morbidity and mortality. On the other side, if you invest and design a city for, say, cycling, active transportation, you get more people to cycle, you get less air pollution, you get more physical activity, less noise, less CO2 emissions, and also you get less morbidity and less premature mortality. The data set that we're working with is this, what you can see here, a range of cities defined by the JRC, what we have boundary layers for, and they're also varying quite a lot in the number of people living in them. To do the estimations, we use a comparative risk assessment approach using the Utopia tool that's been developed. It's a fairly simple approach, but quite robust, and also it provides estimates of mortality or morbidity, depending what you're interested in. So a few years ago, we looked at this for what is the current burden related to air pollution in these 1,000 cities. How many deaths could we potentially prevent? And what we found was that if we would use the new WHO guidelines as the counterfactual exposure to get there, we could prevent 166,000 deaths per year in these 1,000 cities. Most come from reduction of PM2.5 or are attributable to PM2.5, 110,000, and then 57,000 to NO2. But of course, we know also that the WHO guidelines are not fully protective for health. I mean, that we see also health effects below that. So if you go to try to reduce the air pollution levels to the levels in the lowest city or in the city with the lowest level, I mean, that's some cities in Scandinavia, you could actually prevent even more deaths, and you could prevent, more than 200,000 deaths in those cities. So there is kind of quite a lot still to be gained by even reducing the levels below the WHO guidelines. Also, if you look at what we did when we made a ranking, and if you look by pollutant, you see quite a different ranking, partly because there are different sources for the different pollutants, what I'll come back to in a sec. If you look at PM2.5, we see cities like in northern Italy, in the Po Valley, and also in Poland and the Czech Republic with the highest mortality rates, partly as a result of the industry in the Po Valley and the meteorological conditions, and also because of the coal burning in Poland, for example. On the other side, I mean, if you look at NO2, you see big cities with a high traffic density leading the ranking, with Madrid on top, followed by Antwerp, Turin, lots of cars around there. By the way, on the bottom, you can see the ranking where you can get all the data, isglobalranking.org. You can key in your city and see what are the estimates for that. So what is the sectorial contribution to mortality? When we look at all the 1,000 cities together, we see that for PM2.5, for the related mortality, the main contributor here is residential air pollution, followed quite directly by agriculture. I mean, to me, it was a bit of a surprise to see the large influence of agriculture in our cities, but it's the second cause of PM2.5 mortality. This followed then by industry and then transport. On the other side, I mean, when you look at NO2-related mortality, there what we see is that transport is leading. I mean, almost half the NO2 that contributes to mortality comes from transport, followed by industry, energy, and then residential. So depending on which pollutant you look at, it actually looks quite different what contributes to mortality. Here you can see the map as well. What is the main contributor to the PM2.5 mortality or to NO2 mortality? And it's what you can see if you look at the north of Europe. You see that, for example, agriculture is the main contributor. I mean, while at other regions, it's residential sources that contribute to the mortality for PM2.5. For NO2, you can see that it's mainly the transport sector that's contributing throughout Europe. The other thing is, though, to what extent does the city contribute to itself, to the air pollution levels and mortality, or does it come from somewhere else? And that also differs to which pollutant you actually look. If you look at PM2.5, if you look at the mortality related to PM2.5, then only the city itself contributes 13.5% to the mortality, so a very small proportion, while most of it comes from the country, from the rest of the country, or from transboundary exposure. On the other side, if you look at NO2, then the city, to a large extent, contributes to its exposure and the mortality-related mortality, followed by the country, first then the country, but then also transboundary. So the picture is quite different. And so the city in that way doesn't have so much influence on the PM2.5 exposure and related mortality for PM2.5, but more for NO2. This is our ranking website. If you go to that, you can have a look. I mean, you can look at the ranking for the cities and also the source contribution. for everything. Also, it's not only on air pollution, but also on green space and noise, what is there. What does it mean for policy? This is, that overall, of course, we need more stringent EU legislation, and hopefully tomorrow we get a positive vote, and also the Council takes it on, because that drives a lot of it. But then also, for NO2, you need more local actions to address the levels. I mean, you can think about, low emission zones, what we hear about later, change in urban design, and more active transportation. But on the other side, for PM2.5, you look for actions also outside the cities. And, although cities can influence each other, of course, but, you need to look at a larger country or interregional levels, and also look at other types of policy measures that actually are coming in. But I think it's not only about air pollution, you want to look at it a bit more holistically. We did a health impact assessment in Barcelona. We looked at the number of different factors, not only on air pollution, what is the contribution to mortality, but also on noise, heat, green space, and the lack of physical activity. And we found that about 20% of the overall mortality was attributable to these factors. So we shouldn't only improve air pollution or reduce the air pollution, improve air quality, but address something or come up with policies that also address green space and physical activity, bring this all together. So we need to look more at holistic solutions. We know, for example, green space was just mentioned as well, that the lack of green space leads to poor mental health, but also to premature mortality. In our cities, in the 1,000 cities, we estimated that there would be up to 43,000 premature deaths each year, or we could prevent 43,000 premature deaths each year if we would green our cities more and come closer to the WHO recommendable levels for green space. The WHO says that everyone should be living within 300 meters of a major green space. So there also for green space, there is quite a bit of health benefits to be reached. So I think what we need to look at is more what I call novel urban models. Like the low traffic neighborhood in London. Rachel will be talking about it in a sec. The 15-minute city that's been promoted in Paris quite successfully, or car-free neighborhoods like in Vauban in Germany, or what we have in Barcelona, the Barcelona Superblock. So I'm going to give you a quick run-through for the Superblock because I think it's a wonderful idea and can be very effective. So the idea for the Barcelona Superblock is that you cut off some roads for motorized traffic, some junctions, and allow only active transportation there, and like walking and cycling, and also green. So on the left side, you can see what is the current situation. We have a grid system, cars up and down, left and right, And then on the right side, what is a super block, cut 4 junctions in a block of 9, and green it, and only active transportation. So this is one example of a Barcelona super block. The top, what was it before? Sant Antoni market, and at the bottom, what it was afterwards, where you can see few cars there, more green space, people walking, not as many. I think this is in the afternoon, they have their little siesta. But you get the point of it. It looks as a much nicer environment. The idea was to implement 500 superblocks in Barcelona, and we did a modeling exercise. What would be the benefits? And what we expected, what we predicted was a reduction of about 20% in cars driving around, 25% reduction in NO2, some reduction in noise, an increase in green space, and also a reduction of temperature because of the green space, so a reduction of the urban heat island effect. We estimated that if you would introduce this novel urban model, we could prevent almost 700 premature deaths each year in Barcelona. The biggest contribution would come through the reduction of NO2. We have very high NO2 levels in Barcelona, by the way, nearly 40 micrograms per meter cube. So there is a lot to be reduced. But then also, could prevent premature deaths because of a reduction in noise, urban heat island effects. We know that there are many premature deaths related to that, increase in green spaces, and then also some through an increase in physical activity. Here the physical activity is underestimated because we didn't have good data on physical activity for this. But you can see, a novel urban model like this doesn't always improve air quality, but also other factors what are, I think, very important as well for health. To make it happen, we need a multi-sectoral approach. I'm coming from a public health perspective, can't change anything, so we need to work with urban planners, transport planners, but also, people from the education sector. I mean, still too many kids are being taken to school by car. Because it's not safe. So let's take them in the car, get more cars. I mean, that's what we need to work with schools, saying don't have kids coming by car to school, but have them cycle or walk, for example. Can things be done? I believe so. Seoul before had a very busy motorway running through the city. Now they've got a nice waterway, green space. Düsseldorf, Germans love their cars, of course, but we're happy to give up a bit of the road space here in Düsseldorf to get a really nice area on the water where people actually could enjoy, and fewer cars. Amsterdam wasn't always for cycling, whatever you were thinking about. In the 70s, there were a lot of cars around. There was a lot of pollution around. Nowadays, everyone seems to cycle. And it's in many, I think, Dutch cities you actually see this, that it's taken a long time, but it's possible. If you want to know a bit more about our project, UBD Policy, please visit our website with some examples as well, and it keeps us up to date. And if you have any questions, I'm happy to answer them, or you could email me, because I think we don't have any time, and we go straight to the next presentation, but I'm always happy to address your questions. And finally, I would like to thank all my co-workers who all do the work, and I'm here presenting. Thank you.
Thank you very much, Mark, also for broadening the picture a little bit and emphasizing that the design of a city is ultimately very important as specific traffic measures and how we heat our homes and so on. And pointing out at the very beginning that going below the WHO standards, doing more entails a further potential win in terms of reducing premature deaths. So there's a lot more to do still beyond simply aiming to comply with those. And then interesting, very clear the differences depending on what type of pollutant you're looking at in terms of where it comes from, in terms of also a city's ability to control that particular pollutant, and in terms of the impact it ultimately has. And of course, knock-on effects for policy. So working traffic measures to reduce NO2 is something a city can really do, whereas when it comes to PM 2.5, a lot of that will originate from outside the city, and again, then depending on where you are in Europe, primarily agriculture in the north, primarily from heating if you're looking at northern Italy and Eastern Europe, for example. We'll come back to some of those issues, also the engagement of citizens in our sessions after this one. Thank you. Next up, we have Zorana Jovanovic-Anderson. She's a professor in environmental epidemiology at the Department of Public Health, the University of Copenhagen. She's also chair of the European Respiratory Society's Environment and Health Committee, and she's done a lot of work looking at the interlinkages between air pollution and health. And she's here to talk to us today about the health pacts of air pollution and climate change in cities.
Thank you very much for a nice introduction and for organizing this important event. So I'll jump straight to a little bit more details about really what we believe is the main reason for air pollution action, and that is health. So I would like to give a brief overview on the health effects of air pollution to bring, besides all the numbers we've seen on premature deaths and the health impact assessment projects, just to give you a brief overview of what's the newest knowledge on all wide range of diseases and impacts air pollution has. As well, I want to link this to climate change. We've seen just yesterday on the news, climate change, especially in Europe, is really breaking, again, all the records. This also has very much related impact to health related to air pollution. So I want to bring some of the newest results on that, especially related to temperature and wildfires. And put a little bit respiratory patient and organization I'm presenting in the center of that. So air pollution and health is, and as we talked about, both presentations, air pollution is a major environmental. It's one of the major top risk factors for health next to smoking, diet, and blood pressure. Fourth ranking global risk factor for health is not just environmental, but it's really the major risk factor for health. We've seen these numbers, and I just want to mention again WHO air quality guidelines, which told us a few years ago, summarizing all major evidence on health, that air pollution is even more dangerous than we previously known. And this has led to decrease in their guidelines, guidelines for how low we should go in regulating air pollution to prevent disease. This has started ambient air quality directive revision, and we are, as a health community, looking forward very much to tomorrow's vote that hopefully concludes this project, and we see much stricter European legislation on air pollution. This is really important for health. I'll go through a number of newest results and state of the art and the number of health outcomes that we haven't heard so much today. We heard about deaths, but I want to point out on what we know on air pollution. So air pollution and lung effects is something that is close to us at European Respiratory Society, something that has been studied the longest and that we know most about. And we know that air pollution from before birth through entire life affects our lung function. It reduces the optimal lung function development from childhood on. It reduces our optimal lung functioning to the rest of our life. And this is the main reason why air pollution increases risk of asthma already in childhood, posing a really important burden to children in asthma. That we know have resulted in a tragic death of Ella Debrakisi, which has been a historical court case, putting kind of a face to death related to air pollution, which is not just an elderly chronic heart or lung patient, but also a child with a complicated severe asthma can actually have a very severe consequence from air pollution. Air pollution also leads to a number of new cases of adult onset asthma and chronic respiratory diseases. And the daily variations of air pollution also pose big challenges to patients with asthma and can exacerbate the breathing problems, need for medication or hospitalization. So air pollution is really arguably the biggest challenge for respiratory patients, and they feel this in their daily life. We know that reduction of air pollution matter, and one of the important studies in Sweden, in Stockholm, one of the cleanest cities in Europe, also showed that even in Sweden, reductions in air pollution over the last 20 years have contributed to better lung function in children. So cleaner air pollution, better lungs function, even there where air pollution is lowest, the improvements matter. This has really been an important message for policymakers in the last few years. COVID-19 pandemic has put, of course, a lot of strain on public health and health concerns in Europe, but also has renewed interest in air pollution impacts on immunity and our risk of both getting a respiratory infectious disease, but also how well we manage to deal with this disease. And we showed clear associations now that air pollution increases risk of our contracting COVID, and not just COVID, also pneumonias and influenzas and other respiratory diseases because of reduced immune ability because of air pollution. And this has really posed a whole another additional argument apart from non-communicable diseases and chronic disease linked with air pollution. We see now that also our populations would be more resilient to respiratory infection pandemics and epidemics every winter if we cleaned up the air. Air pollution affects cardiovascular disease. Cardiovascular disease is the #1 cause of death, and a lot of these deaths we see in the statistics on air pollution burden are due to heart disease. And we have now solid evidence on air pollution causing major ischemic heart diseases such as myocardial infarction, stroke, heart failure, but also arrhythmias and disturbances of the heart rhythm that also cause a lot of disease burden, hospitalizations, medications, sick days, and so on. Air pollution, through that impact on cardiometabolic system, is also causing diabetes, mainly considered lifestyle disease, but we see now clear link how air pollution can promote inflammation in the fat tissue and causing insulin resistance. And this is also, of course, increasing burden on our societies and healthcare costs. And just to show you some of the numbers on this, about 20 to 25% of all diabetes and cardiovascular deaths are due to air pollution. So these are quite considerable fractions of disease due to air pollution, of this major public health burden or causes of death. Air pollution and cancer is another big topic. It's since 2013, so now more than 10 years, that we know from EARC, International Agency on Research on Cancer, that air pollution is carcinogenic to humans, grade 1, the highest level of evidence. And we knew since last 10 years also research has been showing that air pollution is likely also causing other cancers than lung. We have emerging evidence on breast cancer, liver, stomach, bladder, kidney, and we'll see more evidence emerging. And this has been focused on the BICA, on the Europe Beating Cancer Plan, and very much focused in EU, acknowledging that the environment likely has bigger impact of cancer that we've known, and calling for more research and also more actions in cancer prevention to deal with air pollution directly. And finally, something of the biggest concern just recently is air pollution impact on the brain. Besides stroke, we've seen increasing evidence on air pollution impact on brain, again, from childhood to entire life. In childhood, air pollution impairs cognitive development. Just yesterday, we have seen results from 2 studies, one in Spain, in children, impact on ability to concentrate, and in Denmark, we did studies on school grades in children. We've seen consistent results. And this can later lead to, in later end of spectrum, in increasing risk of dementia. We see now many studies that confirm this clearly, as well as Parkinson and other neurological diseases, as well as increasing evidence that these brain inflammations caused by air pollution can cause our mental health, depression, anxiety, suicides, and so on. And we see also fast emerging evidence on mental health and air pollution. Air pollution is also closely linked to climate change. This was also brought up. It's the same sources, also very same solutions, really. So we really want to bring silos down both in research and policy on these issues. We all know, I guess I don't need to show you this from news, from your feeling, this air pollution. Planet is warming up at an alarming rate. The new records are being broken year by year, month by month. And if you've seen this, there are a number of these record-breaking events are really showing up on the media week by week. And we also know now that Europe is warming up much faster than the rest of the region, and this is, of course, impacting a lot of cities in Europe. Especially cities are already, we've seen hotspots of air pollution because of density and transport and residential heating and all commercial industrial activities in the cities. But cities also have this urban heat island effect, which means that the temperature is higher in the cities because of the both building materials, concrete and asphalt, and lack of green areas and the population density. So the impacts of heat are also exacerbated in the cities compared to the rural areas or suburbs. This also just came out yesterday. Again, new data just confirming that Europe is warming up twice as fast as the rest of the globe, and this will pose challenges to European cities. So here I'll show a little bit results of the big EU project, Exhaustion, which exactly examined impacts on heat and air pollution and their interaction on health. And they have done this in a database of the many European cities and show these curves how temperature increases risk of dying in both extremes, cold and warm. But of course, with this doesn't impact equally all the cities around Europe. But we see that factors increasing heat health effects are especially increased air pollution, high population density, urbanization, and lack of green spaces. So all the mixes that we have in the cities. They also have showed results about aging populations are also contributing to this, so just another demographic factors of the Europe and the cities. And they show also that now we have about 3,000 deaths attributed to hot weather of heat waves in Europe. This is likely to increase not just 10 but 20 times or 30 times, depending on different projections, to over 60,000 deaths by the end of the century. And of course, there's a number of projections in how fast we're warming up, but we'll see dramatic increases in number of deaths due to heat, although some cities and some areas will have less deaths due to cold weather. There are net benefits in some areas of Europe, but overall, a number of heat-related deaths will definitely override that, and we'll see much higher impacts of temperature on death. So they also estimate that some of those can be avoided by cleaning up in air pollution, because that's the way to mitigate effects of heat and also to slow climate change warming because of mitigating greenhouse emission of gases. Another very important result the project brought up is to show that there's a synergy between effects of air pollution and heat on our health. This is a big study in the cities in Europe showing that we know that on the days with high air pollution, there's more deaths due to respiratory disease. Same for days with hot weather. But where you have a mix of two, on the days with hot weather and high air pollution, there is more than effect on individual two factors. So there's especially high risk for respiratory deaths on hot days with higher pollution, which will be in the cities. So this is really additional argument to do more about air pollution to mitigate effects of climate change, and especially heat on our health. Another big concern related to climate change is increase in wildfires. Again, 23 is one of the record-breaking years, and this is likely to continue, especially in the South and Eastern Europe, where the heat effects are, and the droughts related to heat, of course, predisposition for wildfires are largest. And the project also showed both future projection, but just looking back in the last 40 years, since the 80s to 2020, we see the sharp contribution of wood smoke fires to overall air pollution levels of Europe. We see that in the 80s, in the 80s, wildfire smoke were almost posing a small fraction of overall PM in Europe, but that is increasing now. And we see that especially a little bit different regions, especially in Eastern Europe and Southeastern Europe, by the end of the century, we'll have more PM from wildfires than from other sources. So this is increasing concern also because they are showing up together with warm weather and droughts, and this will really exacerbate the health effects, especially on respiratory patients. Does this impact our cities? We would think of wildfires, maybe it's a more rural area problem or not. We know that it will. We don't know where and how much. But the recent episode from Canadian wildfires that brought this huge episodes of air pollution in not just in New York City, but entire East Coast and the East Coast of Canada has really seen how dramatic these consequences of wildfires can be. I think you've all seen these dramatic pictures from New York City. And we've seen also on some of the data, these are plotted concentrations of PM due to wildfires going from somewhere below 20 to over 80, close to 100 in these few days. So unseen pictures from these cities. And we see also the emergency visits for asthma in these 4 hospitals also sharply increased. So this is a clear link. So just to conclude, in European Respiratory Society, we also, of course, we have been working on air pollution for many years, but we also recently, just last year, published a climate change position statement to show our concern and really urge for the action on climate change on respiratory patients. We have also mentioned the temperature and wildfires. There's a clear link. Respiratory patients are very responsive to hot, especially hot and humid weather, and the biological understanding of how this affects respiratory patients is clear. But also there are a number of other concerns for respiratory patients. We also see increases in flooding and moisture events in the cities. We also see spreading of new allergens that are of the problems to respiratory patients. Thunderstorms and storms also bring exacerbations of asthma and so on and so forth. Here in this statement, we of course call for policymakers to speed up the climate change mitigation measures and also see air pollution and climate change as a joint agenda for health. Of course, we also focus a lot on education of respiratory patients and clinicians in mitigation of health effects for respiratory patients. And by this, I would just like to conclude that, of course, we have solid evidence on air pollution health effects. We still haven't fully mapped health effects, so whatever numbers we've seen today, they're likely going to increase because the new fast emerging evidence is showing the new diseases and stronger association between health and mortality. So what we know is likely going to get worse, and just strengthens our point that we need to act as soon as possible. UN, WHO, COP28 has also put health on agenda. We see recognition of this across international organizations, and we know that air pollution reduction is a major, for us, not environmental, but really health, public health, planetary health, and climate policy to deal that would significantly improve health and as well as mitigate effects of climate change. Cities, we have seen of solutions from Mark in Alberta, but we also know what to do in the cities, and here reductions of the car traffic, improvement of active travel, which brings additional benefits in increased physical activity and well-being, and a greening of the cities are some of the policies that will play a key impact here. And with this, I'd like to thank you.
Thank you very much, Zorana. Also drawing attention to the fact that it's about more than just premature deaths. There's a lot of other health impacts that air pollution can have, notably lung function. And you pointed out, even when air quality is relatively good, improvements still matter. They still make a difference. Also cardiovascular disease, diseases like diabetes, which we tend to associate more with lifestyle. Air pollution is carcinogenic. The brain is affected, it impairs cognitive development. And finally, a synergy, a negative synergy between air pollution and climate change. One exacerbates the other, which means, for example, there's a particularly high risk of more deaths on hot days with high air pollution. And one particular element of that negative synergy, wildfires, are making up an increasing proportion of PM 2.5. And wildfires, of course, then again, exacerbated, or one of the consequences of climate change. Thank you. Got two more presenters. Rachel is next, Rachel Aldred. She's going to talk about how low traffic neighborhoods can help bring down motorized traffic and improve health. Rachel's a professor of transport at the University of Westminster in the UK and director of the Active Travel Academy. She's someone who does a lot of work on sustainable mobility, is a founding editor of the open access journal Active Travel Studies, and also sits on the editorial board of various other travel journals. Go ahead.
Great, thank you, Sonia. I'm going to keep an eye on the time because I know people will be thinking about coffee, and I get quite enthusiastic about data. So it's very sad for me to see the UK missing from all those beautiful EU maps, although maybe we've improved your environmental indicators by taking our dirty cities out. So, I don't know, do I have a clicker to move on the, is it this? Okay, brilliant. So I'm going to talk about low traffic neighbourhoods. So this is one specific measure. This is not to say that we don't need to do a lot of other things, but this is the measure that I, with colleagues, have been studying, and it has some relationship to superblocks that Mark was talking about. It's a means of reorganising cities away from being based around motor traffic. So I just wanted to take a moment to say where this comes from in a London context. So 10 years ago, around £100 million was invested in active travel infrastructure in 3 outer London boroughs. So this is basically providing Dutch-level investment for a sustained period. So really transformational expenditure, certainly in the UK context. and it included low traffic neighbourhoods, which is what I'm going to talk about, which were also built from 2020 onwards elsewhere in London. So low traffic neighbourhoods, as people may be aware, like many other measures like low emission zones, are quite controversial. They attract a lot of scrutiny, and this prompted us to study their effects. I'm not an air pollution expert. I've looked more at co-benefits around physical activity, reduction in driving and so on, but I will touch on air pollution, as obviously that's also very important. So low traffic neighbourhoods, people may be familiar with the idea. Like superblocks, they restrict motor traffic. They can involve very simple measures. On the left, you can see wooden bollards, which is just stopping people driving through. On the right, you see a little map for one of the first low-traffic neighbourhood areas in London, built under the Mayor's Vision for Cycling around 2016. So this is Walthamstow Village, and the point is that there's a range of measures that are all restricting motor traffic in that area, in that neighbourhood. A range of different measures. Sometimes it's cameras that permit through certain permitted traffic and not others. Sometimes it's bollards. It can involve a range of things, but the main point is it's an area, it's a set of streets from which most or all through motor traffic is being removed. So quite an interesting intervention. And one of the things that for me is exciting is that it's not a city centre. It's not a big ticket item. You can build these where people live, in the suburbs. Potentially a lot of different types of street could be treated in this way. This just gives you an example of a kind of after picture. This is the kind of measure that they put in place in these outer London boroughs. This is in Waltham Forest. So we were very lucky in that we were studying, when low traffic neighbourhoods were being built, we were already studying the Mini Hollands programme in these outer London boroughs. The survey was called the People and Places Survey. Now, a lot of this research has been published. If you look at my Google Scholar page, you'll find a lot of these papers, because I'm going to have to go fairly quickly through some of the results of the research, but you can find it all online. Basically, we had a longitudinal study where a lot of our results come from. We had 1,500 people participating year on year for 6 years, which is very exciting. It's a long time follow-up. So we looked at their travel behaviour, and we were able to look at whether different kinds of active travel infrastructure, low traffic neighbourhoods, cycle tracks and so on, whether this affected people's travel behaviour, whether it affected how they felt about their local area. And the study was funded by Transport for London. We were very grateful for that. So that map just shows in blue 3 outer London boroughs where some of these measures were built. And as I say, these are suburban areas. They're not inner London. They're not central areas. They're places where most people live, the kind of places where most people live. And this gives a sense of the scale of what was built. This was early in the programme. This is the London Borough of Waltham Forest. In blue, you see the low traffic neighbourhoods that were built in the first couple of years of the programme. The black shows new cycle tracks. So quite a lot of stuff. If you visit London, you can leave Big Ben to the tourists. You can go and visit the London Borough of Waltham Forest. I can tell you where to go. But there's some quite interesting measures built. So a few of our results, which you can find out more about from our research papers that have been published. So firstly, the low traffic neighbourhood areas saw a reduced likelihood of residents driving. Perhaps around 20% less likely, residents were perhaps around 20% less likely to have driven in the past week. So potentially quite a substantial decrease in the likelihood of driving. And what we found with this survey was generally a dose-response relationship, that the more interventions that were put in place, the more evidence we found of a change in travel behaviour. We found that there was a decline in driving in the low traffic neighbourhood areas, not so strong evidence in other related to other interventions. We also found substantial growth in active travel. So the grey bar, where you see the biggest results, those are people who are living in low traffic neighbourhood areas and usually also near new cycle tracks, other active travel infrastructure. And we're seeing, potentially around 60, 80, 100 minutes more of active travel a week compared to the control group. This is really substantial. I was surprised by the scope for more active travel, particularly growth in walking. So there seems to be a lot of scope for more local walking. Some of that comes from car trips, some of it doesn't. Some of it is probably because low traffic neighbourhood areas are more pleasant, there's less car traffic, often they're greener, people are walking more in day-to-day life, and that's a good thing for a range of reasons, right? Particularly if we've reduced air pollution. We've done a health economic benefit analysis using tools developed by the Department for Transport in the UK, and we found that the Mini Hollands programme of walking and cycling infrastructure generated around 10 times more benefit from the additional physical activity than it cost in terms of the programme cost. And most of that benefit is concentrated in these low traffic neighbourhood areas where we see these really substantial increases in physical activity from more walking and cycling, and you get a substantial reduction in mortality. You also get fewer sick days taken because people are healthier. We've looked at a range of other outcomes as well. We have a lot of secondary data available that we've used to look at the impacts of these low traffic neighbourhood schemes. So Waltham Forest, which was the London borough that put most of those in during that period between 2015, 2020, 2021, we looked at car and van registrations. Probably you have this data in many countries. It's to do, when you buy a car or a van, you have to register it annually with the government. So we have data on car and van registrations. And we looked at what happened when these low traffic neighbourhoods were introduced to car and van registrations. And it dropped 6% after 2 years and 7% after 3 years. We also found a reduction where there were other walking or cycling schemes, but not as strong. So this is quite substantial. One of the biggest determinants of how much you drive is whether you own a car or not, right? So the fact that car ownership and car use are dropping is really important. 6 to 7% reduction in car ownership. What does that mean? Well, a similar reduction was found in Amsterdam with very, very stringent restrictions on car ownership in the city, where basically you have to pay for private car parking for years before you can store your car in a public garage. So, this is quite a substantial reduction. We also looked at road injuries. So over 20,000 people die on the roads in the European Union every year. A substantial burden, many, many more are injured. Many of us are friends, we know people, we have been injured ourselves. In these low traffic neighbourhood areas, we found around 70% reduction in road traffic injury risk for pedestrians, cyclists and car occupants. So the background trend is an increase, the red line. The blue bars are showing the decrease in the low traffic neighbourhood areas. So a benefit in terms of road injuries there as well. Larger than you get with 20 mile an hour, 30 kilometre an hour zones, for instance. We've also looked at more recent low traffic neighbourhoods across London. I'm going to just finish giving you several results from those. So this has included incorporating them within our longitudinal study, but also looking specifically at their impacts with other data. So this is an example of emergency schemes. You may have seen similar types of thing in your city during COVID. They're not as pretty, right? They just put in place very quickly, but they have similar goals. So we looked at changes in motor traffic in these low traffic neighbourhoods. So these are the emergency low traffic neighbourhoods. So the top picture, the bottom picture, first of all, that is on internal roads. This is across 47 schemes in London, 600 data points, traffic count data. So the bottom picture is showing you that generally there is a reduction in motor vehicles inside low traffic neighbourhoods. It's generally around 30% or so. So that's good, but that's what we expected. The top picture is interesting because that is boundary roads. That's roads on the outside of low traffic neighbourhoods where you might expect there to be more motor traffic if it moves from one part to another. What we're seeing is there's no clear picture Around half of those boundary roads saw an increase in motor traffic, around half saw a decrease, which is suggesting that there is substantial traffic evaporation, i.e. a lot of trips that previously took place are not happening. Some are and some aren't. So this again suggests this reduction in driving, a reduction in car use and car ownership associated with these schemes. We also saw reduced road injuries in the emergency low traffic neighbourhoods. So there, the red line is the background trend. That is a reduction in injuries across the rest of London because of COVID, because of less driving. But the blue bars are showing that there's a much stronger trend in the low traffic neighbourhood areas, a much stronger reduction there. And that's mostly a benefit for pedestrians, interestingly. We also used some data from the government on driving related to vehicle tests. So annual vehicle tests provide data on miles, kilometres driven. And these were our findings that were published related to 3 low traffic neighbourhoods in Lambeth, where we were able to get this data and match it to vehicles in low traffic neighbourhoods and not. Basically, what you're seeing there is diverging trends. So the background trend, the blue line, is more driving. The red line is inside these low traffic neighbourhoods, less driving. So again, it all kind of goes together to suggest a picture of less driving, less car ownership, more walking and cycling with these schemes. And finally, a study that I'm mentioning because it's on air pollution. This isn't our study, but colleagues at Imperial College, Audrey Denazal and her colleagues, used nitrogen dioxide data to look at 3 low traffic neighbourhoods in Islington, and they found a reduction in nitrogen dioxide inside the low traffic neighbourhoods, but interestingly also on their boundaries, so in a wider, area-wide improvement in nitrogen dioxide. And like the other studies, this is compared to a control area, so it's controlling for the background trend. So yeah, I think that's sort of a tour of some of the results of these studies. So generally, motor traffic reduces inside these areas. There doesn't seem to be a systematic pattern on boundary roads, so there doesn't seem to be a systematic disadvantage for people living on their boundaries. There's more walking and cycling. It looks like less driving and car ownership, and some evidence of reduced air pollution. So yeah, obviously there's a lot more things that need to happen, but these seem to be promising results for these kind of schemes as part of it. So thank you very much.
Thank you very much, Rachel, for some insight and plenty of data there indeed into low traffic neighborhoods, a bit like the superblock idea that we heard from Mark earlier. Very controversial, but yeah, all the numbers you showed suggested that there's less driving. There is less car ownership, at least fewer car registrations, a big reduction, 70% in the rate of traffic injuries on roads in these neighborhoods, and also interesting, an impact on boundary roads, sometimes more traffic, sometimes less, but a suggestion that some of these trips that would otherwise have happened are not happening. And overall, the investment, the UK investment you spoke about, the 100 million in active travel, a clear health economic benefit to that. 10 times more benefit than cost associated with the increased physical activity from that. And finally, of course, air pollution, what we're here to discuss today, benefits from this reduced motorized traffic in these neighborhoods. Again, go to Rachel over coffee if you want more data or have any follow-up questions on that. That brings us to our final presentation before coffee, and don't worry, we will still have a coffee break. And our final presenter is Luc Bruineel, who's the lead who leads scientific and economic matters at the Mutualites Libres. He's also a guest professor at the KU Leuven Institute for Healthcare Policy. He works on both research and policy, has done a series of master's degrees, including, and then also a PhD in biomedical science, and some study on big data analytics and how that can inform business and management. So Luc is here to present the preliminary results from Mutualites Libres' study into low emission zones here in Belgium and their impact on health.
Thank you, Sonia. Good morning, everyone. I'm very pleased to present some first preliminary findings of an ongoing evaluation that we are conducting on the health impact and air pollution impact from the introduction of low emission zones in Belgium. The research is funded by Bloomberg Philanthropies, to whom we are extremely grateful. So thank you, Anja, and also big thanks to Luca from Brussels Environment for instigating this collaboration. So the research brings together expertise and researchers from the Independent Health Insurance Fund, so the Mutualites Libres, HEAL, but also from KU Leuven, U Hasselt, Vito, and Irselin. Irselin is the Belgian Interregional Environment Agency who are responsible for collecting, analyzing, validating also and processing all data on air quality in Belgium. And it are those data that we use in this study and that we link with many other types of data. So, as we have heard in previous presentations, air quality has luckily improved significantly over time. And by way of introduction for Belgium, and I know you have already seen some slides, but here I think it's very interesting to look at Belgium in more detail. You see how PM 2.5 has evolved between 2017 and 2022. So here we analyzed data from Irselin at the neighborhood level. Neighborhood is census tract, maybe it's better known, and there are about 20,000 census tracts in Belgium, which is a geographical level below the level of the municipality. And so median PM 2.5 values across these neighborhoods dropped from 10.8 in 2017 to 8.6 in 2022. And the lowest concentrations can be found in 2020. So the impact of the COVID-19 lockdown, as we have heard in the previous presentation, is also clearly visible here. Since the COVID lockdown in 2021 and 2022, air pollution has been increasing again. But preliminary data from Irselin show that in 2023, concentrations were even lower than in 2020 in some of the major Belgian cities. So this is all very good news, it's excellent, but it's not enough. We shouldn't stop trying to improve. WHO air quality guidelines recommend annual mean concentrations of 5. So as you can see, this is still a long way to go. At the level of the neighborhoods, it can be concluded that about 10% of neighborhoods meet those AQG values in 2022. However, these findings may be misleading because in particular, as you can see, the less densely populated areas in the south of Belgium, in Wallonia, are doing well. When we look at an individual level, and it's very small, but it's on purpose for privacy issues. When we look at an individual level, we see that about 1.5% of our members meet these WHO AQG values. So how are we able to calculate this? We can geolocate our members and we can then calculate annual residential exposure to air pollution around their home address. So we did that, as our CEO has introduced. We have about 2 million members, and we can do that for each individual member or their family. My colleague kindly asked me to skip some slides that I can skip for the sake of time, so I will skip these slides. It is very clear by now that air pollution is having a tremendous impact on human health. And as we have also seen from the slides of Mark from IS Global, poor air quality is a big problem. It's a chronic problem in major Belgian cities, in Antwerp, but also in Brussels. So as we have seen in the slides from Mark, Antwerp ranks only second worst to Madrid in terms of NO2 pollution, and Brussels, and it wasn't on the slide from Mark, but Brussels is joining them in the top 10. So Brussels and Antwerp, two of our major cities, are doing very, very poor. An important side note, however, is that these are data for 2015, and I know that there has been some type of validation for 2018, but a lot has changed since then. And in the next few slides, we will see how Antwerp and Brussels perform today. So to improve air quality within cities and ensure that people can enjoy cities more, there is a wide range of urban air pollution control policies and strategies. And this website nicely summarizes all these different strategies, or at least part of these strategies. So popular measures include rules for traffic entering cities. low emission zones, and other traffic management schemes are now widespread in major cities across Europe, and currently more than 300 LEZs are in place. Last year, there was a systematic review published in Lancet Public Health, which covered about 8 studies on the health impact of LEZs. And it concluded that low emission zones may improve health outcomes linked to air pollution. Evidence is most pronounced for cardiovascular outcomes, but there are less consistent findings for other outcomes. And also these and other studies remind us that LEZ or other policy-induced pollution reductions may have a lagged effect. It may take some time for the health impact to become visible. Air pollution has a negative impact on all of society, but some socioeconomic groups are more affected than others. International research shows complex patterns depending on cities' socioeconomic configuration as well as road networks. So we will look into some findings for Rome and London. Rome, already in 2001, so more than 20 years ago, introduced 2 low emission zones in the city center. And in the city center in Rome, this is exactly where the least deprived areas are found. So the most wealthy people live in the city center of Rome. And so these wealthy people experienced greater concentrations of air pollution compared with more deprived areas. Overall, since the introduction of the LEZ in Rome, NO2 and PM10 concentrations declined significantly over time, and the greatest decreases were found in the areas of least deprivation, so for the most wealthy residents. In London, on the other hand, the most deprived areas experienced greater concentrations of air pollution compared with the least deprived areas. And with the introduction of various policy measures, such as congestion charging zones and LEZ, so the NO2 and PM2.5 concentrations have declined significantly over time. And in London, the greatest decreases were experienced by the most deprived areas. Between 2013 and 2019, there has been a 50% reduction in the difference in PM2.5 between the most and the least deprived people in London. Over to Belgium. In Belgium, there are 3 zones that progressively remove the most polluting vehicles from their roads. These LEZs in Antwerp, Brussels, and Ghent are in place since 2017, 2018, and 2020, respectively. And tighter emission standards, depending on the type of fuel and the Euro standard, have already come into force and are planned in the near future as well. The objective of the study that we are conducting is threefold. First, we evaluate the impact on air pollution from the introduction of the LEZ compared to other cities. And this is an important aspect that we add to previous press communications on the impact of LEZ on air pollution in Brussels, Ghent, and Antwerp. Secondly, we evaluate if air pollution disproportionately affects low socioeconomic groups and how this has evolved over time. And third, we evaluate the health impact from the introduction of the LEZ. The third part of our study is ongoing, and findings will be presented at a later occasion, but nevertheless, we will look into some aspects of the methodology. So I just referred to the inclusion of control cities, and in this study, we included the 20 most populated Belgian cities, which includes the 3 LEZ, and in addition, 17 control cities, of which 7 are located in Wallonia and 10 are located in Flanders. Within those cities, we selected close to 176,000 of our members that lived at the same address during the study period that we defined, which includes 10 years from 2014 until 2023. So let's now look at the methods and findings for the first research objective, which is to evaluate the impact of the introduction of the LEZ on air quality. So based on the member's geocoded home address, we calculated residential exposure to PM2.5, PM10, NO2, and BC. All these abbreviations have been heard in the previous presentations, but just to note, NO2 is nitrogen dioxide and BC is black carbon. And we calculate this using the high-resolution atmospheric air quality model that was developed by Vito and Irselin, and that allows an estimation of air quality with a very high spatial resolution. We compare Antwerp with control cities in Flanders because Antwerp implemented its LEZ in 2017, and atmospheric data for the baseline year, 2016, are not available in Wallonia. We compare Brussels with both Flemish and Walloon cities, since the LEZ was implemented in 2018, and atmospheric data for the baseline year are available for the whole of Belgium in 2017. Looking at the findings, we clearly see that air quality has improved, which can be observed from the large decrease in concentration levels, which are presented on the y-axis, over time, which is presented on the x-axis. And we observe an overall more rapid, and it's statistically significant, a more rapid decrease since the introduction of the LEZ in Antwerp and Brussels compared to cities without an LEZ. Thus, it seems that regulating the entry of high-emitting vehicles works. For example, in 2017, the year before the introduction of the LEZ in Brussels, average black carbon concentration was higher compared to control cities in Flanders and Wallonia. Since the introduction of the LEZ, the decline in black carbon in Brussels outperformed that in control cities in Flanders and Wallonia. And in 2022, the BC concentration was even lower in Brussels compared to that in control cities in Flanders and Wallonia. Please note, however, although this is very positive news, that the annual average AQG level for nitrogen dioxide is 10. And so here you can see that we are still at levels of about 20 in Brussels, 25 in Antwerp, 16 in Flemish major cities, and about 20 in Walloon cities. So a lot of work is left to reach that AQG level. Findings for PM2.5 and PM10 can be interpreted very similarly, and we again see this more rapid decrease in Brussels and Antwerp. And to make it more specific, let's now look at an example for Antwerp. In 2016, the year before the introduction of the LEZ in Antwerp, the average PM2.5 concentration exceeded that of Flemish control cities. Since the introduction of the LEZ, the decline in PM2.5 in Antwerp outperformed that in control cities in Flanders. And in 2022, the PM2.5 concentration was lower in Antwerp compared to the average of the control cities in Flanders. So as mentioned in the beginning of the presentation, the recommended annual level for PM2.5 is 5. For PM10, this is 15. Again, so we can conclude that a lot of work is left to be done. Now for their second research objective, let's disentangle this evolution in air quality according to socioeconomic position. Our measure of socioeconomic position is the recently introduced Belgian Indices of Multiple Deprivation, or the BIMD. It was developed by CINEA, but also the Intermutualistic Agency and many other partners. BIMD is a combination of various domains of deprivation like income, employment, education, housing, or crime. Our focus for now is on Brussels because the level of neighborhoods is more precise in Brussels compared to Antwerp and Ghent, and the socio-economic makeup of the city presents a very interesting case. You see 4 different figures, so let's run through it slide by slide. Oh, figure by figure, sorry. So on the left, you see a visual depiction of the BIMD deciles in Brussels, with more deprived areas in the city center. And so it goes from red, which are the most deprived neighborhoods, to blue, which are the least deprived neighborhoods, and you see a lot of red in Brussels. Second, we overlay the first figure with nitrogen dioxide concentrations. And so it shows that the inner ring road, with its pentagonal shape, and the adjacent streets across the more deprived areas. Third, we added green space to the picture. So we see that while greener environments can mitigate the harmful effects of air pollution, more deprived neighborhoods are exposed to more air pollution, which we've shown on the second slide, but also less green, which is shown on the third figure there. Last, for your information, we also add data from Stadbel. And it shows that the average number of cars by household is rather low in Brussels compared to Flanders and Wallonia. And we know from a previous report by Brussels Environment that almost half of the cars that drive in the LZ on an average day are registered in Flanders or Wallonia. Previous research looking into the social justice argument against or in favor of the implementation of the Brussels LEZ has shown that more deprived areas generally had higher proportion of non-compliant cars, but also have access to better public transport. These are very important findings that we show now, and 4 things can be observed. First, everyone has enjoyed reductions in air pollution irrespective of socioeconomic position. So we recalculated the BIMD deciles into 5 groups, going from yellow, which are the least deprived people, to red, which are the most deprived people. And you can clearly see that air quality is consistently worse with each decrease in deprivation. And these differences are very worrisome. For example, in 2022, most deprived neighborhoods had a concentration of NO2 of 22 micrograms per cubic meter, while the least deprived neighborhoods had a concentration of about 14 micrograms per cubic meter. So this is far from the WHO AQG guidelines. Third, we can also see that for black carbon and NO2, the LEZ resulted in a statistically significant faster improvement in air quality for the most deprived groups, similar to what has been observed for London. Fourth, despite this, and I've already mentioned it, people living in more deprived neighborhoods are still exposed to levels that far exceed the WHO AQG guidelines. Take, for example, PM10. And the concentration in the most deprived neighborhood in 2022 equals the concentration of the least deprived neighborhoods back in 2017. So that's a huge, important finding. We yet have to conduct analysis for the third part of our research, but we can already look into the methodology. At Mutualites Libres, we have very rich and well-structured databases containing individual-level administrative and accounting data of a medical care that is provided to a person on a given date. And this allows us to create proxy indicators of a wide variety of health outcomes that have also been looked at in previous studies on the evaluation of LEZs. In our analysis, we will control for individual level characteristics such as age, gender, and nationality, but we will also control for characteristics of neighborhoods, the BIMD, but also tree cover, differences between urban and rural status, etc. And we will operationalize this through propensity score methods. To account for the correlation that we can expect among the multiple measurements on a given subject, so we will take data for 10 years, a generalized estimation equation approach will be used, and our analytic framework is a comparative interrupted time series analysis. So within an observational setting, it is one of the strongest study designs to examine causal associations. So in conclusion, first, air pollution is very harmful to our health, and multiple measures will be needed at the urban planning and mobility policy level to reach the WHO AQG. And why not go further? I think we've heard from Mark that going beyond these WHO AQG levels has additional benefits. Second, we have shown that low emission zones in Belgium successfully clear the air by prohibiting older vehicles with higher emissions from entering the area. And I believe that in the near future we can even see some bigger effects, because in 2022 Brussels banned Euro 4 diesel vehicles. Third, very importantly, there is unequal exposure to air pollution. There is a clear association between deprivation and poor air quality. However, the differential evolution in air quality across socioeconomic groups in Brussels suggests that those people who may find it most difficult to adhere to the changes promoted for the LEZ are also those who stand to gain the most. So the environmental justice argument in favor of the implementation of the LEZ holds. And since people living in more deprived neighborhoods tend to be more susceptible to the negative effects of air pollution compared to people living in less deprived neighborhoods, also in our health impact analysis, this aspect will receive a lot of attention. Thank you for your attention.
Thank you very much, Luc. Thank you, everyone, for your attention. I realize it's been a long morning session. Presentations will be available. I know Luc in particular went through a lot. I think his last slide summed up the main points very well. I take away one of his first points too, which is that only 1.5% of Mutualites Libres members currently meet WHO standards. So that's a very small number. And then encouraging news on the low emission zones. We do see faster improvement in air, a faster drop in air pollutants across the board where those zones have been introduced. And a focus on deprived areas which still suffer the most, have the most to gain, and are also benefiting the most, whilst also still having the longest way to go. We're going to break for coffee. Please do put any questions you may have to our speakers over coffee. We're going to try to resume in 15-20 minutes, so let's try and aim for 10:02. If you want to grab coffee and make your way back here as soon as you've got it, chatting as you do so, then that would be most welcome. Our next session is going to focus on citizen engagement to get some of these measures like low emission zones over the line. Thank you very much.